Hello, today is April 20th, 2022. My name is Selma Montoya. I'm interviewing Elizabeth Montoya for the South Texas Archives at Texas A&M University, Keatsville. This is a part of the Voices of Pandemic Oral History Project in partnership with Voices Oral History Center at the University of Texas at Austin. Please know, Ms. Montoya, that this recorded interview will be placed in the South Texas Archives at Texas A&M University, Keatsville, and shared with the Voices Oral History Center at the University of Texas at Austin. If there is anything you do not wish to answer or talk about, especially given the fact that your recording may appear online, I will honor your wishes. Also, if there is something you want to talk about, please bring it up and we'll talk about it. Because we are not conducting this interview in person, I need to record your consenting. So I'll ask you a series of 6 questions. Please say yes, I agree, or no, I do not agree after each one. There are 4 questions we need to make sure you agree to before we go on. South Texas Archives at Texas A&M University Kingsville wishes to archive your interview, along with any other photographs or other documentation at the South Texas Archives at Texas A&M University Kingsville. We will retain copyright of the interview and other materials you donate to the South Texas Archives at Texas A&M University Kingsville. Question 1. Do you give us consent to archive your interview and your materials at the Jernigan Library at Texas A&M University, Kingsville?
Yes, I agree.
Question 2. Do you grant South Texas Archives at the Jernigan Library at Texas A&M University, Kingsville copyright over the interview and any material you provide?
Yes, I do.
Question 3. Do you agree to allow South Texas Archives at Jernigan Library at Texas A&M University, Kingsville to post this interview on the internet? Or it may
Yes,
be.
I agree.
Question
Sorry, keep going.
Question 4. Do you grant South Texas Archives at Jernigan Library at Texas A&M University, Kingsville consent to share your interview and your materials with the Voices Oral History Center at the University of Texas at Austin for inclusion in the Voices of Pandemic Oral History Project, which will include posting the interview online?
Yes, I agree.
Question 5. Do you wish for us to share the rest of your interview in your public file available to researchers at South Texas Archives at Jernigan Library at Texas A&M University, Kingsville?
No.
Question 6. On occasion, Voices receives requests from journalists who wish to contact our interview subjects. We only deal with legitimate news outlets. Do you give us consent for us to share your phone number, your email with journalists?
No, I do not agree.
Now, Ms. Montoya, tell me a little something about yourself.
Well, I am a nurse. I'm an LVN. I've been doing home health and working in geriatric care for the past 20 years. I'm married, no kids. Right now, I'm working at a nursing home.
Okay, now Ms. Montoya, I will be asking questions about COVID-19. Tell me a little bit about your experience with COVID-19.
My experience with COVID-19. Well, personal wise, we were restricted of doing a lot of things. We weren't able to go out. I had family members who got COVID. We had to deal with that. We had to also take care of my mother who's elderly and try to prevent her from getting COVID. There was a lot of changes at work. There was a lot of personal changes. There was a lot that we went through. I think everybody did.
Okay, Ms. Montoya, how did you first learn about COVID-19?
First, I learned about COVID-19 was from the news outlets when it came that people were getting sick in China. Then from there, it came over here, and then we started learning from the doctors, the news, the CDC, the people who the county, they regulate a lot of the nursing home policies. So that's when we started getting more information.
What was your initial reaction to all this information?
At first, it was overwhelming because we knew there was going to be a lot of changes that were going to be going on through our job. I work at a nursing home, and we were trying to protect our patients from the virus due that they're elderly and they're more susceptible to the illness. So those were a lot of stuff that we had to do.
At what point did you realize this was serious, or did you not think it was?
At the point where we started having increased records in our county, like we started with the first, then the two, and then it went up to like 10 and then 14, and it kept going up and up and up. And then we started getting patients who actually first it started with coworkers that started getting sick. And then finally we got some patients that got sick with COVID.
How did that initially make you feel, seeing that your patients, your coworkers getting sick?
Um, for the initially we were, well, everybody was scared. We were scared. We didn't know how to prevent this. Um, we had to learn from not wearing masks one day to wearing masks like through your whole job shift. We had to learn to try to isolate ourselves from other people, and we had to get accustomed to the new ways that we had to live our lives.
At any point, did your mental health change?
My mental health, no. I think I was just going day by day, trying to keep people safe at work and at home. I did notice my mom did get a little bit of depression because we weren't able to see other family members as much, because we were trying to keep her safe.
How did you keep your mother from being depressed?
We would take her out to for drives. We would drive around the city. Um, I would take her out to the country for drives. We would stop at like a Dairy Queen, and I would get her an ice cream and to the drive-through, and then she would eat it on the way home, or would stop somewhere and we would eat it in the car. Um, we got her Netflix. She started seeing more TV. We had my sister's number and put into her phone with like dual, so she can see them face to face. And she would talk to her grandkids and my sister through there. So that kind of kept her okay.
I know that you said that you couldn't see family members and stuff, but in your job, where you have to be around with a lot of people that are currently sick. By any chance, during the beginning of COVID-19, did you interact with anyone?
Well, at work we would interact with each other, but we would wear a mask. We had our patients, and when we first started getting COVID patients, we had to clear a hall for them, and you would have to suit up completely. We would wear a gown, mask, goggles, gloves, or a face shield. Um, After when we go back to our office, we would keep our mask on. There was usually at least one or two people per office. We tried not to, when we still have our group meetings, we would have it outside, and we keep a good distance between us.
When when COVID first started, when you go out, what were the things that you took with you?
Okay, we had our bottle of alcohol gel. We had a bottle of Lysol. We had our gloves. We had our mask. Um, Me and my husband would either go and do the curbside, so they would bring it to the car. If not, we had to go inside. Uh, he would push the cart, and I would get the stuff from the grocery aisles and put them in the cart. Um, we worked as a team. We would go get checked out, then we went back into the car, and then we would take off our gloves and wipe our hands down. We put some more gloves on, and then take the stuff out of the bag and spray them down and put them in the car. And then we take off the gloves again, and we would wash our hands with the alcohol gel, and then we would get back in the car, and then we would come home. It was a big old process.
How did you fear? How did you feel about wearing masks all the time?
We, I knew we needed it. It was kind of something you had to get used to. You would have the marks around your face, especially at work when we use the N95 mask. Some of my coworkers were getting skin breakdown around the nose bridge. When you would wear your goggles or your face shield, sometimes because of the mask, you would get the fog, so it'd be kind of hard to see sometimes. Um, but there was a big adjustment because when you're wearing your mask and you're trying to take care of patients, it does get hot. It does get sometimes you kind of find it hard to breathe, but you kind of just push through it. And when there was your break time where you can go to your car and take off your mask, that would give a little break in between.
Do you currently still wear your mask, and do you currently still do the things that you and your husband did when COVID first started?
Currently, we've been a little bit more relaxed with it. We are vaccinated. We do have the boosters. Um, we do wear our masks when we go into stores or any public place. Um, we After we're done with the store, we do use our alcohol gel before and after. When we bring this stuff in, we kind of just wipe it down with some Clorox wipes, but it wasn't like before. It's a little bit more relaxed.
I noticed that you said you got vaccinated. Did you get vaccinated because of your work, or you wanted to get vaccinated for your own health?
Both. I knew that I needed it for work because it was mandatory, and for my health because this virus is crazy. We don't know what it can do. It was kind of hard at first, um, but with healthcare right now, I think it was mandatory for everybody to get the vaccines. But from personally, I wanted to get it done because I kind of wanted to give myself an extra layer of protection just in case I did get COVID.
How was it like scheduling your vaccination?
It was pretty easy because they're at work. The pharmacy would go in there and they gave the residents that had agreed to the vaccine, they gave them the vaccine and then they would give us a vaccine. So we didn't have to schedule anything. They would just they called all the nursing homes and they scheduled their own clinics, vaccine clinics, and that's where we got our vaccines.
Did you have any side effects when you got your vaccinations?
Um, the only thing I noted was just the soreness to the arm, but I get that with the flu vaccine. And then mm, joint pain, but I didn't really know it was from the vaccine or it was because I have arthritis, so it could have been either or. But I didn't get any of the other side effects.
Did you do anything to change your health when COVID first started than before when COVID wasn't exist?
Mm, we started walking in the afternoons just to get the fresh air. Um, so we would walk a little bit more. We start doing our walks in the afternoons.
What kind of concerns or questions about healthcare have emerged as a result of COVID?
Mm, concerns healthcare. Mm, that I know of in the nursing home, there was a lot of concerns from the family members because they were scared uh, for the family members to get COVID. I knew here in the valley there was a lot of nursing homes that started getting the outbreaks of COVID with our patients. Um, we tried to do the best that we could there in the nursing home, and then we would send them to the hospital. Would be like their last resort. We did if somebody were just to get like a regular, let's say a UTI that needed IV medication or URI that needed any kind of IV medication, sometimes they would go to the hospital and get it done there, and then they would come back and we would finish off the doses. But we starting them off with the doses of the vaccines. We tried not to send the residents to the hospital as much as we could. We tried to take care of most of the things inside the facility.
And for your patients, how did your work environment help them not be so stuck in where they are now? And like, because knowing that COVID-19, you guys have regulations where people couldn't be in there. So how did your work environment help them see their family?
Um, what we started doing FaceTime with our iPads, so families could call and talk to the residents. We also had where the at the front of the nursing home it's all windows, so we would put one patient on one side and one patient on the other side, and the family members could see them through the window and talk to them. They would have the company's cell phone, and their families would call to that cell phone. So they can talk to them and see them at the same time. They were able to drop off food for them. Um, and then our activities department would try to do a lot of activities with the residents. Sure, they would have to be separated, but they would try to keep them entertained with like having bingos in the hallway or chalupa. They play chalupas down here, little things like that. They even had hallway karaoke where the activity director would be going down the hallway with their karaoke machine and singing to the patients.
How did this all make you feel seeing your patient go through all this?
Well, it did make us. I mean, all me and my coworkers, we were a little bit sad for them because they had that daily interaction with their family members that would go every day and see them, to being cut one day that they couldn't go in. A lot of patients were getting depressed, so that's when our activities director would step in and try to help them out. We would also schedule FaceTime with families, but we were kind of sad for them too because it was a big change um, for them. You go from one day of seeing your daughter every day and then not being able to see her for a long while in person or be able to hug them.
Did you guys inform them about COVID-19 or did their family members inform them?
Um, we spoke to them about it, their family members too, and they would see the news too. So the people that were cognitively able to understand, they knew what was going on. The ones that weren't, that have dementia or are not able to understand, that would be kind of hard for them because usually their family members are the ones that were their constant thing that they would see. And we noticed more changes in them behaviorally when the visitations got cut.
Did you ever feel like backing off from work, taking a break, or changing your environment of work, like getting another job or anything like that?
No, because COVID is everywhere, and no matter, being a nurse, you're going to be anywhere. I mean, you're going to be exposed to COVID. So it doesn't matter where you work at, unless you work as a nurse from home, doing televisits or something. But other than that, you're always going to be exposed to COVID. So you kind of have to roll with the punches. So I never thought of changing. I mean, I always wanted to be a nurse, and this is part of nursing.
Currently, are you still working in the same facility as we are speaking right now?
No, I recently moved to another facility. Um, but the when COVID started, I was in the other facility, and that's when we would do all of this. Right now, in the facility I'm in, well, and as other facilities, uh, COVID has a lot of the patients are vaccinated. Um, the visiting has changed where patients, family members are able to come in, but they have to wear their mask at all times and not take it off.
How do you believe politics affected how COVID has been handled?
Um, let's see. Politics. Well, I mean, they tried to do the best that they could for us. It was new. It was new to everybody. This virus that was out there. Um, I know some people thought we opened up too fast, and they were saying it's because the politicians wanted to be um, like the wanted the economy to start up again. But I mean, the vaccine's available, and that usually helps with helping the world go around again. Um, Other than that, well, I mean, politics is politics. They're gonna try to do what's good for the community and them.
In your area, how did COVID affected them as you've
Who
seen?
affected the nursing home, the patients, or the
Your area where you live.
um. Well, there was a lot of restaurants and businesses that closed due to the COVID and the quarantining and not able to open like they used to. There's a lot of places that are not there anymore. Um, Unemployment did go up. Um, what else? And a lot of people lost loved ones. So I think it affected the community financially and emotionally.
Did COVID impacted your ability to financially contribute to your family?
Can you repeat the question?
How has COVID impacted your ability to financially contribute to your family?
Um, it hasn't really affected anything because you work in healthcare, and the where healthcare is the one that's fighting the COVID vaccine. So it didn't. I didn't work in the food industry or anything like that, so I know those got affected. But for me, I mean, I went to work every day, um, helping patients, and I didn't. There was some nurse shortages because some didn't want to be with the taking care of people with COVID, so we had to step up and we had to work more hours. So it didn't really. It only affected us work wise, not financial wise, because we had to work, so we had to work every day.
What did you personally have to do more in your work environment? What changed from the beginning and then when COVID happened?
Mm, I was a office nurse at that facility, And when COVID hit, we actually had to start helping on the floor because some nurses did decide not to stay there. We would also help with as CNAs because we had CNAs that had stopped working. Would help feed patients. We would try to help make beds. We just needed a little bit more on the floor than we did when we were in the office. It was long hours. Sometimes we would stay longer than we usually scheduled to, um, helping out the floor nurses and the CNAs.
Um, did you or anyone in your family contacted COVID?
Yes. My sister and her family had COVID, and my brother and his family got COVID.
How did this make you feel? What was your like initial reaction as a sister, as the oldest sister?
Mhm. I was concerned more for my brother because he does have underlying health conditions. My sister, she is a little bit younger and she does try to take care of herself. So I was least concerned about her and her family than my brother and his family.
Did your family ever come to you because you are a nurse? Did they ever ask you for any um, advice of what to do when they contacted COVID?
Hello?
Can you hear me?
Yes, yes. Okay, yes. Um, yes, they always call me for everything, no matter whether it's COVID wise or anything wise. And I would try to give them the best information I could give them, the knowledge that I knew of this virus. I would give them tips on how to take care of it, what to do, um, how to quarantine themselves, what kind of vitamins to take, fluids. I would give them tips.
That's good. Um, During COVID, we had election for presidential. Um, during the social movements, did you ever take a in part of that? Did you ever participate in those movements?
No, I didn't, because I would be at work mostly all day. Would get out late, but I never participated in any of those gatherings or protests or anything like that.
Do you think they did it impacted your daily life?
The protest?
Yes.
No, not really, because you really didn't see that much of those protests down here in the valley. Um, so they weren't shutting down roads or anything like that, like they would do upstate or up the New York area, California area. It's more calm down here in the valley than it is elsewhere.
How did it make you feel seeing all those people all close together during those times in the early COVID-19?
It made me feel like how can I say this? It would drive me nuts because it's like you know what COVID does, and you guys are all gathering together. Some people weren't wearing masks, some people were, um, and they were all close together. So it would kind of seem like they were. I would read about the nurses in the hospital and how they were being overworked and stuff, trying to take care of people who had COVID, and then you would see all these people out there, some of them that weren't vaccinated and um, protesting or not caring about getting the virus. And it was kind of like, what are you doing out there? I mean, here are these nurses and doctors that are trying to take care of people who are sick, and they're just saying you avoid large crowds, avoid being close together, and you're doing it. You're not. You're not. Like they weren't doing the part. That's the way I felt
Do you
to
believe
help
they were
control.
the do you believe they were the cause of overpacked in hospitals?
Uh, Not really. I mean, there are people out there who they didn't believe in it, and it's only natural because everybody was quarantined for a long time, and then they started slowly opening stuff up. So, I mean, most people want to be out, and if you're young, you really don't want to be just trapped in. I mean, it's understandable, but it's also kind of like defeats the purpose of those nurses and doctors out there trying to help other people when they help them, and the people who aren't taking care of themselves are walking into a hospital too.
Seeing in the beginning of COVID how hospitals and everywhere was so packed, there was no oxygen for patients. How did how did that affect your work? Did you guys have any less, you know, less equipment for to help others to treat others?
Um, we were limited before. You weren't limited to the amount of supplies they would order like gloves and sanitizers, and then when this started, they started getting limited. Like they could only order a certain number of boxes of gloves. They could only order a certain number of uh, sanitizers. So we had to kind of like try to get new things and or buy alternative stuff to try to help um, help us with the lack of the other stuff we had. Um, it was hard trying to get oxygen. To this day, I think it's still hard trying to get oxygen at the home for patients because of the limited supply and um, because we're still battling COVID, so they kind of limit things still. It's not like what it was before, where you would just get whatever you wanted.
In your area of work, were you around hospitals, other healthcare, daycare, anywhere? Did you all, if so, did you all contribute of giving each other supplies, or did you all only stick to one, like stick it for yourselves, like only kept it for y'all and your patients?
The company I used to work for, they had their supplies that they had in reservoir. So if any of our companies needed it, like the nursing homes that they owned, they would the company had their own reservoir, so they would get whatever they had. Um, Other than other like hospitals and stuff wanting us to donate anything, they never really asked us for anything like that. So we didn't go through anything like that.
Okay. Is there anything else would you like to share with me about your experience with COVID-19 that I have not asked about?
Mm, let's see. What have you not asked about? Um, well, just there at the nursing home. I mean, our residents did get a lot of behaviors due to not having that family interaction that they had. So there was a lot of increased depression, increased agitation, uh, more behavioral problems. That's when we kind of had a hard time with that. But we would try to get them in contact with their families, try to, like I said, we would schedule the FaceTimes, we would schedule the meeting them through the windows of the nursing home. We would try our best to do what we could because it did affect a lot of patients all over the nursing homes. It was more their behaviors and their depression.
Did you
But
guys, I'm sorry,
mhm.
did you guys ever consider of having professional there, like psychiatrists, psychologists?
We they do have a psychiatrist, and they would go and do the telehealth through the iPad, and they would go talk to them, and then they would hear them out and talk to them, and then they would prescribe medications if they needed medications. Um, they now that they're open, we have a lot of like counselings. So we have a company that goes in there and they talk to the residents about their feelings, and they just talk to them or talk to their families at the same time, and help them express their feelings. And behaviors aren't that bad anymore now that we kind of opened up a little bit more and families are able to come in and visit their family members.
That's good. How did you guys handle their behaviors?
Um, Sometimes we would have to talk to them, remove them from the environment that was causing the behavior. Would like the activities director would come in and do one-on-one activities with them. They would have talks with them. We would have the families call via the phone or the iPad, and they would all talk together. We would try to do the activities director sometimes would have like ice cream socials, but they weren't like all gathered together. Like they'd be in the hallway in their rooms, and she would go and drop off ice creams or snacks to everybody and talk to them as they were going door to door, just to have any kind of interaction with them, so they could not just be thinking of how they miss their family members.
That's good that you and your work environment did that for them.
Hmm.
Is there anything else you would like to talk about?
Mm, no, that's it. I don't have anything else.
Well, thank you, Elizabeth Montoya, for joining me to do this Voices Oral History project for the University of Austin. Thank you for your time and goodbye.
Okay, you're welcome. Thank you.